All right, let's dive in today. We're going to tackle syringomyelia in Cavalier King Charles Spaniels. SM for short.
Yeah, it's a tough one. A neurological condition causing, fluid-filled cavities in the spinal cord.
Leading to some serious pain for these dogs.
Oh, absolutely. It can be really debilitating for them.
And we've got this 2024 research paper from Acta Veterinaria Scandinavica Andoni. What's fascinating to me is how they tried to predict those severe cases without, jumping straight to an MRI.
Right, because those can be expensive. Not every owner has access to that right away.
Exactly. So this study really focused on those CKCSs, already diagnosed with chiari-like malformation, CM, where, the skull shape is putting pressure on the brain and spinal cord.
Yeah, so they're looking at dogs who are already at higher risk and trying to see if there are behavioral signs that can tell us if they've also got a large problematic syrinx.
Okay, so how did they set the study up?
Well, they took data from 89 CKCSs who'd already had MRI scans done at the University of Copenhagen between 2007 and 2014, and they divided them into 3 groups. Okay.
Those with CM and no SM. CM with a small syrinx, so that's 2 to 3.99 millimeters, and then those with CM and a large syrinx, 4 millimeters or bigger.
And they interviewed the owners.
Yeah, they did, but they cleverly focused on the dog's behavior at the time of the scan.
Yeah.
That way they minimized, recall bias, because memories can be fuzzy.
Yeah, that's a good point.
So they were trying to get the most accurate picture possible.
So what kind of behaviors were they zeroing in on? I imagine scratching had to be a big one.
You're spot on. Scratching was key, but not just any kind of scratching. Phantom scratching is what they were looking at, where the dog, goes through the motions, but isn't actually touching their skin.
Oh, wow. So if my dog's like, air scratching, that could be a sign of something serious.
It's definitely a red flag.
Yeah.
Worth investigating further. They also found that bilateral scratching, so scratching on both sides of the body, not just one itchy spot, was another strong predictor.
Makes sense, right? Given that syrinxes can affect the whole spinal cord. Exactly. It's not just a localized thing. And then, of course, sensitivity to touch around the head and neck.
Right. Was that a big factor?
Especially when it came on suddenly, yes. And it wasn't just any touch. They found that often these signs would worsen when the dog was, excited or playing. Like those nerve signals were getting amplified.
Wow. That's really interesting. So we've got the scratching, we've got sensitivity. Anything else that stood out?
Well, one fascinating finding was that the location of the syrinx often correlated with which side the dog scratched more. Like if they favored scratching their left side, the syrinx was often on the left side of their spinal cord.
That is wild. Like there's a direct link between where the syrinx is and where they're feeling the discomfort.
It really is. It shows how even subtle behavioral cues can give us real insight into what's happening neurologically.
So knowing these signs is, incredibly important for owners.
Yeah.
But how reliable are they really? You mentioned something called predictive value earlier.
Right. So positive predictive value, or PPV, tells us how likely it is that a dog showing a specific sign actually has a large syrinx. And that's where things get interesting.
I'm all ears. What were some of the PPVs they found?
Well, for example, phantom scratching had a PPV of 74%.
Okay, that's pretty high.
Yeah, so if you see your CKCS doing that air scratching thing, there's a good chance. A significant syrinx is present. Aversion to touch around the head and neck also came in at 74%. And here's where it gets really interesting.
Okay.
When they combined multiple signs, like phantom scratching, aversion to touch, and a preferred head posture during sleep.
Wait, hold on. A preferred head posture.
Yeah, so some dogs with CM and SM will sleep with their head elevated or in an unusual position, probably to relieve pressure on their spinal cord.
Huh. I never would have thought of that.
It's a subtle sign, but it can be significant. And when you combine those 3 signs together,
The PPV goes up.
it jumps to 91%.
Wow.
So if your CKCS is showing all 3 of those signs, it's almost certain that a large syrinx is causing problems.
So that's a combination that owners should immediately take note of.
Absolutely. It warrants a conversation with your vet for sure.
Okay, so this is super valuable information for any CKCS owner out there. But before we go any further, I think it's important to emphasize these signs, as helpful as they are, they're not a replacement for a proper veterinary diagnosis, right?
100%. An MRI is still the gold standard for confirming syringomyelia, but these signs can be a vital early warning system, especially when cost or access to an MRI is a barrier.
So it's about empowering owners to be more informed and potentially catch this earlier rather than later.
Exactly. Giving them the knowledge to advocate for their dogs and seek help sooner.
Well, we've covered a lot of ground already, and I'm eager to dive deeper into, what owners can do if they see these signs. More to come in part 2.
Yeah, we'll be back soon with more practical advice. Until then.
Welcome back to our deep dive into syringomyelia. Last time we talked about those kind of alarming signs CKCS owners should be looking out for.
Phantom scratching, bilateral scratching, the aversion to touch, even how they sleep can give us clues.
And I thought those positive predictive values were really striking, especially when you start combining those signs.
Yeah, it really highlights how even those seemingly insignificant behaviors can tell us a lot.
So let's get practical here. What should a CKCS owner do if they start to notice these things with their dog?
Well, the first step is always talk to your vet. Explain what you're seeing, how often it's happening, any other changes you've noticed.
Even if they've never had an MRI before?
Especially then. That information is going to be really valuable for your vet in deciding what to do next.
Okay, so it's about gathering information and, getting a clearer picture of what's going on.
Exactly. And if syringomyelia is suspected, then the conversation about an MRI might come up.
Right, because that's still the gold standard for diagnosis.
It is. It allows us to visualize the spinal cord, see those fluid-filled cavities, the syrinxes, directly.
And I imagine it helps determine the severity as well, right?
Yeah. Oh, absolutely. The size, the shape, the location of that syrinx, all those things can influence the dog's signs and their prognosis.
Okay, so what happens if an MRI does confirm syringomyelia? What are the treatment options?
Well, it depends on the severity and pain.
Yeah.
The individual dog's needs. Sometimes pain management medication can help to make them more comfortable. And in some cases, surgery might be an option.
Especially if that chiari-like malformation is playing a big role.
Right. Surgery can help to decompress the area around the brain and spinal cord, relieve some pressure.
So there are different paths.
Yeah.
Depending on the specifics of the case.
Exactly. It's about tailoring the treatment to each dog and working closely with your vet to figure out the best course of action.
So we've got diagnosis, we've got treatment. What about long-term management? Is this something that can be cured?
Unfortunately, no. There's no cure for syringomyelia. It's a chronic condition and often requires ongoing management.
I see. So what does that usually involve, that long-term management?
Well, it often includes a combination of medication, lifestyle adjustments, and regular monitoring to see how they're doing.
What kind of lifestyle adjustments are we talking about?
Things like minimizing activities that might worsen their symptoms.
Like, rough play, jumping.
Exactly. Anything that puts extra strain on their head, neck, spinal cord is best to avoid.
So it's about being really mindful of their limitations, adapting their environment to support them.
Absolutely. And those regular vet checkups, so important to monitor their progress, adjust meds if needed, and address any new issues that pop up.
Right. So it's a lot of responsibility, but it's also a chance to really deepen that bond and understand their needs.
It really is. You're becoming their advocate, their voice, making sure they get the care and support they need.
This has been so informative, but I know we're not done yet. We've talked about diagnosis, treatment, management, but what about the emotional impact of this condition on both the dog and the owner?
That's a crucial part of the conversation, and is what we'll be diving into in the final part of our deep dive. Join us as we explore the challenges, the support systems available, and the unwavering love that helps us navigate this journey.
Welcome back to the deep dive. We've spent the last 2 parts really digging into syringomyelia, looking at everything from early signs to treatment.
Yeah, and now it's time to talk about, the emotional side of things. Because it's not just a physical challenge. Syringomyelia affects both the dog and their owner.
Yeah, it's got to be tough. Watching your CKCS struggle, knowing there's no easy fix.
It can be heartbreaking, especially those early stages when you're just trying to figure out what's wrong, that feeling of helplessness.
And even after you get a diagnosis, there's the weight of managing this chronic condition.
It's a lot, emotionally, practically. Meds, lifestyle changes, vet visits, it all adds up.
And the financial burden too, right? MRIs, medications, maybe surgery.
It's a significant commitment, that's for sure. So being prepared for that is important.
Absolutely. So how do CKCS owners, how do they cope with all this? Are there resources, support systems out there?
Well, your vet team is a huge resource. They can answer questions, offer guidance, and even just emotional support.
Right. And what about connecting with other owners
Yeah.
who are going through the same thing?
Oh, that's invaluable. Online forums, support groups, breed organizations, they can all provide that sense of community, shared understanding.
Makes you feel less alone.
Exactly. You find people who get it, who can offer advice, empathy, and just, a shoulder to lean on.
And I think sometimes it's just about acknowledging the hard stuff, the grief, the frustration that comes with this condition.
Absolutely. Allowing yourself to grieve is part of the process.
But, in all of this,
Yeah.
there's also this incredible resilience in these dogs.
And in their owners.
Oh, every day I see it. The love, the dedication. It's really inspiring. The commitment to giving these dogs the best possible life.
And the dogs themselves, they teach us so much about living in the moment, finding joy in the little things. It's true. They adapt. They find happiness, even with their limitations. It's a reminder to focus on what really matters.
So as we wrap up our deep dive into syringomyelia, let's remember that sense of hope, that unbreakable bond between people and their dogs.
A bond that goes beyond any challenge, a love that never fades.
And knowledge is power. Being informed, observant, proactive can make a world of difference for your CKCS.
Early detection is key. And with the right care, the right support, and a whole lot of love.
These amazing dogs can live full, happy lives.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.